A smile is worth 1,000 words. But in Canada, for some parents and their children, sometimes it feels like it costs $1,000. Today, we are diving into the challenges parents face in ensuring their children's dental health and exploring how the Interim Canada Dental Benefit potentially helps bridge the gap. My name is Menon, and I'll be speaking to you about parents' views on access to dental care and the Interim Canada Dental Benefit, or CDB. I will read out the land acknowledgement now. In the spirit of respect, reciprocity, and truth, we honor and acknowledge the traditional Treaty 1 territory, the original lands of the Cree, Oji-Cree, Dakota, Dene, Anishinabeg, and the birthplace of the Red River Métis Nation. We recognize that Northern Manitoba includes lands that were and are original home to the Inuit. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to incorporating traditional teachings and practices in our health promotion and research activities to reclaim good oral health. When we speak of healthcare in Canada, historically, the Canadian healthcare system, often referred to as Medicare, did not include dental care services. Now, this omission was partly rooted in prioritizing equitable access to primary health services, with dental care often viewed as separate from general healthcare needs. As a result, for the longest time, dental health remained largely outside the scope of Canada's publicly funded healthcare system. And it continued to exacerbate accessibility challenges, especially for the vulnerable population groups. Also, public spending on dental care in Canada, it accounts for only around 6% of total dental expenditure. Now, this is significantly lower compared to countries like the United States, as well as nations where the public dental care program is more robust and comprehensive, like the United Kingdom. This limited public funding in Canada covers the cost of dental care for certain groups of people. And of the limited public funds spent on dental care, the federal government contributes via insurance programs for military personnel, members of the RCMP, veterans, and federal prisoners. In addition, the federal government operates the Interim Federal Health Program, otherwise known as the IFHP for refugees, and the Non-Insured Health Benefits Program. Provincial governments finance dental care for specific population, including low-income children, social welfare recipients, individuals with disabilities, and those with craniofacial disorders. Municipalities often co-share costs for low-income children's care and social welfare recipients with provinces, while low-income seniors receive independent care. Despite these government investments, research has shown that access to oral health care remains a significant challenge in Canada, with over 32% of Canadians reporting financial barriers to accessing dental services and nearly 48% of uninsured individuals avoiding necessary care due to the cost involved. With this in mind and some political pressure, in December 2022, the Government of Canada launched the Interim Canada Dental Benefit, or the CDB in short, which I'll use interchangeably going forward, as the first step towards a long-term Canada-wide dental care plan. The CDB provides a direct payment of, it provided a direct payment of up to $650 per eligible child, which was sent directly to parents to help pay the cost of oral health care for that child. And the CDB was a temporary benefit that provided a direct tax-free payment to help eligible families pay for oral health care services for their children under the age of 12. And to date, over 400,000 Canadian children benefited from the CDB, and it remained in place until June 30, 2024. And once the CDB ended, those children were eligible to transition to the Canadian Dental Care Program, assuming they met the eligibility criteria. Before you is timeline from the advent of the CDB till its sunset, as well as the commencement of the CDCP in mid-2024. Now I'll speak a little bit about the Canada Dental Care Plan. The Canada Dental Care Plan is a federally delivered public plan, and the intent here was to help ease financial barriers to accessing oral health care for up to 9 million uninsured Canadian residents with an adjusted family net income of less than $90,000 annually. I would also like to touch on what access to care signifies. Access to care is a complex issue, and it involves affordability, availability, accessibility, acceptability, awareness, and accommodation. The Interim Canada Dental Benefit and the Canadian Dental Care Plan are significant steps towards equitable dental care in Canada. And these initiatives aim to improve affordability for lower income families and promote inclusivity in healthcare. Research has continuously showed that multiple factors influence children's use of dental service. Now, these include their parents' dental care utilization, their level of education and socioeconomic status, their income, their employment status, access to dental care, availability of dental insurance, behavioral beliefs, perceived power, subjective norms, and parental preventive practices. Studies have shown that racial and ethnic disparities in dental care utilization are significantly reduced when a child has a parent who uses oral health care and has access to child care and continuous insurance coverage. With that in mind, the study's aim was to investigate the perspectives of parents of children under 12 years of age on dental care accessibility challenges and the Interim Canada Dental Benefit in anticipation of the CDCP. This was a cross-sectional study, and this analyzed data that was collected from a public opinion research online survey that was undertaken by the Strategic Council on behalf of Health Canada's Oral Health Branch in March 2023. So the target population was parents or children less than 12 years of age with a household income of less than $90,000 per annum and without private dental insurance. A telephone recruit to online approach was used to reach those residing in remote communities who met the eligibility criteria. And the survey was administered from March 3 until March 30th of 2023. And the online survey included 45 questions and it covered the demographic characteristics of the respondents, for example, age, gender, education, and employment. Apart from attitudes towards dental care, access to and use of dental services, barriers to accessing dental care for children, and awareness and their views on the interim CDB. So these questions were developed in collaboration with Health Canada. Also, quotas were applied to this base sample of 2,000 to ensure that there was a broad representation from all regions of Canada. And a more significant proportion, that 70% of Canadian parents with no access to private dental care insurance, as this is one of the requirements of the eligibility for the interim CDB. Additionally, there were 2 sample booths of 100 people each. This was carried out to ensure good representation from those residing in remote areas, that is, those located over 350 kilometers from the nearest dental professional and or without year-round road access. And those who identify as being a member of an ethnic minority community. Now let's go into the results of the study. A total of 2,203 parents completed the online survey, and it had a 65% response rate. The majority of the participants were between 25 to 44 years old. That's 78% of the participants. 62% were female. 77% said that they were married or in a common law relationship. 74% were employed and lacked private dental insurance, was 67.8%. 47.5% said that they have university education. Over 80% said that they lived in urban centers. And there was a wide distribution of household income levels, with nearly 45% earning $60,000 or more. And the distribution of income levels showed some regional variations as well, with the Atlantic region having a higher proportion of participants under $40,000 per annum. The ethnic backgrounds of participants as well was diverse, with the largest group being Western European, that was 25.8%, while another 13.2% identified as Canadian Indigenous. Now let's look at the barriers preventing parents from taking their children to a dental office or oral health professional on a regular basis. Among the barriers listed, the cost of the service was a major barrier across all provinces that prevented accessing dental services, followed by the lack of dental insurance and cost of service for multiple children in need of dental care. We'll look at all this in more detail. Over 45% of the participants reported taking their child to a dental office or oral health professional within the past 6 months prior to the survey, with results ranging from 51.7% in Atlantic Canada to over 35% in Manitoba and Saskatchewan. There was no significant difference between urban and rural respondents. Overall, over 66% reported that their child's last visited an oral health professional within the past year or less, with results ranging from over 77% in Atlantic Canada to 56% in Manitoba and Saskatchewan. More parents from rural regions reported their child last visited an oral health provider within the past year compared to urban regions. Only over 34% of respondents reported having the cost of dental services for children covered by an insurance or government program, with many having to pay for the services out of pocket. When they were asked about the barriers that prevented parents from taking their child to see an oral health care professional regularly, participants selected the cost of the service, lack of dental insurance, cost of transportation, and school or work commitments, apart from anxiety or fear, among others. Over 90% of the participants were very or somewhat concerned about the affordability of dental care in Canada, with regional responses ranging from 88% in Atlantic Canada to over 93% in Manitoba and Saskatchewan. There was no difference in response between urban and rural dwellers. Further, over 80% were very or somewhat concerned about accessing the service of a dentist or oral healthcare professional. Among all participants, almost all of them indicated that regular dental visits for children were very important, with similar responses across regions and between urban and rural dwellers. A majority of participants reported they would schedule more regular dental care appointments for their children or themselves if they had some extra money. When we speak of access to dental services, the Atlantic region had the highest proportion of respondents who reported that they had access to dental services for the entire family, while Manitoba and Saskatchewan had the lowest proportion of residents who reported access to dental services for the entire family. Surprisingly, more respondents in rural regions reported having access to dental services for the entire family than those from urban areas. Overall, over 51% of the participants reported having access to a dentist or oral health professional for their entire family, and over 18% had access only for their children. When we speak of awareness of the interim CDB, 6 in 10 parents reported hearing about the interim CDB, but only over 22% were well informed about the program. Manitoba and Saskatchewan and Atlantic Canada had the highest proportion of people who were unaware of the interim CDB. Interestingly, a higher proportion of parents were aware of the program in rural areas. That was over 67% compared to urban areas. At the same time, parents from rural areas were less likely to apply for the CDB than parents from the urban areas. More than 70% of the respondents from British Columbia had applied or planned to apply for the program. Atlantic Canada had the lowest proportion of participants who had applied or planned to apply for the program. Over 60% of the participants without access to dental insurance had heard about the program, and more than 70% were planning to apply or had applied already. When we look at the parental support of the Interim Canada Dental Benefit, the overall support was 87%, with 63.8% strongly supporting the CDB. And there was very little opposition to the interim CDB. When we compared it by dental insurance, those without insurance showed slightly higher support compared to those who were currently insured. When we look at the support by region, Manitoba and Saskatchewan showed the greatest support, and this was at 90.4%. And this was followed by Ontario, British Columbia, and Quebec. Next, for applications or intentions to apply, overall, over 66% of the respondents said yes to applied for the CDB or planning to apply. With over 22% saying no. Of those saying yes, 18.2% had already applied, while over 48% were planning to apply. By region, Ontario had the highest saying yes among the regions, and Atlantic Canada had the lowest yes among the regions. Now, when we try to look at it between rural areas and urban areas, access to oral health care can be influenced by place of residence, with increasing oral health disparities seen in children from rural regions. Now, this study could not explain why rural dwelling participants reported better access to care. The study's findings are not entirely generalizable to all rural populations, as it did not include participants from very remote areas of Canada, where access to oral health care is limited and reliable internet service for the online survey was unavailable. Contrary to common perception, in the study, rural areas sometimes reported better access and more frequent dental visits for children compared to urban areas. This phenomenon may be attributed to targeted rural health initiatives or the lesser competition for dental service in these areas. Such findings suggest that rural dental service provision would benefit from unique models of care that are tailored to their less dense population. In the Canadian federal budget from 2024, the government had stated its intent to include more healthcare professionals working in rural and remote communities in the Canada Student Loan Forgiveness Program, which is only currently it's only available for doctors and nurses. In the United States, loan repayment programs have effectively influenced healthcare providers' practice locations and retention in rural communities, providing incentives for new graduates to work in underserved communities could help address the current distribution of oral healthcare providers in Canada, as well as increase access to care in areas of shortage of oral health professionals. Additionally, mobile dental clinics, as well as enhancing the public transportation, could provide more consistent as well as widespread access to dental care facilities. Especially, it would benefit those who live in underserved rural areas. And it could also, alleviate some of this geographical as well as physical barriers that is reducing the access to dental care. Significant disparities in access to dental care were also observed between regions in Canada, with Manitoba and Saskatchewan reporting poorer access and a higher reliance on urgent or emergency dental services when compared to other provinces. Many individuals in these two provinces had a higher rate of seeking care only when it was necessary, and a notable number of children did not see a dental professional. Now, this reflects broader challenges in access that's observed in these regions, especially in rural as well as remote areas. Now, despite these challenges, there has been substantial public support for the Canada Dental Benefit in these provinces, and it indicates a strong community recognition of the substantial gaps in the existing dental care system. And this is demonstrated by the higher and above national rates of children receiving the interim CDB, which was reported in another paper by the research team. Now, while there is a clear demand for better dental care, organized dentistry in Manitoba especially had shown resistance to the CDCP. At the beginning of 2024, 44% of the licensed members of the Manitoba Dental Association participated in a survey, and the results showed that the majority of respondents are unlikely or very unlikely to participate as a provider in the CDCP. Mind you, and this was done in late spring last year. A lot of things have changed since that point. This highlights a significant gap between public support that you saw in the previous slide for funding oral health care for the uninsured, as well as the dentist opposition for the CDCP. Given the existing access issues, this significant opposition suggests a complex interaction between healthcare professional policy as well as professional practice norms. Also, the dental profession across the country has been welcoming the new initiative, but had its concerns as well. While they appreciated the chance for patients to get improved access to care, standardized care, and better patient outcomes, they were concerned about possible lower reimbursements, increased paperwork, loss of autonomy, funding uncertainty, as well as patient expectation issues. The introduction of the interim CDB, it marks a significant milestone in updating the Canadian oral health policy and addressing affordability and accessibility challenges. This has long plagued the Canadian dental care system. The CDB and more recently the CDCP are designed to mitigate financial barriers to dental care. However, these programs may not adequately address other crucial barriers such as lack of awareness, accessibility challenges, as well as cultural appropriateness of services. These gaps emphasize the need for strategies that go beyond cost reduction to ensure that there is inclusive access to dental care. This study had limitations. We were reliant on an online survey, which may have excluded non-internet users, those in rural areas with limited internet access, as well as people who are unwilling to participate. And this could introduce selection bias, as their attitudes and behaviors may differ from those who responded. The sampling format may have impacted the findings in rural and urban areas. Consequently, this cohort may not represent the entire target Canadian population. Furthermore, the cross-sectional design limits the ability to ascertain causality between perceived barriers and actual utilization of the CDB. The use of aggregated data did not allow further analysis of associations as well. Exploring parental perceptions towards the CDB could greatly benefit from a more diversified methodological framework, possibly incorporating qualitative components to capture a better understanding of their perceptions. This brings me to some of my final thoughts. The study showed high parental concern, especially regarding affordability and accessibility, which remain critical issues. There's a broad support for the interim CDB, and it reflects public recognition of the dental care gaps. And future directions could include continuous evaluation and policy adjustments. Ultimately, this is a significant milestone in updating the Canadian oral health policy by addressing the affordability and accessibility challenges. The CDB and more recently the CDCP are designed to mitigate financial barriers to dental care. And as I mentioned earlier, it may not adequately address other crucial barriers, which would include lack of awareness, accessibility challenges, and cultural appropriateness of services. So the need of the hour is for strategies that go beyond cost reduction to ensure inclusive access to dental care. Some of the policy implications that we highlighted include refining the CDCP outreach by developing multilingual resources and improving awareness campaigns, to address the regional disparities by focusing on underserved areas, including Manitoba and Saskatchewan, and providing incentives for dental providers by implementing measures to attract professionals to rural areas. I would like to deeply thank my co-authors, Dr. Viviane de Cruz Jesus, Dr. Robert Schroth, and Dr. Jorma Virtanen, as well as the CIHR. Thank you very much for your time.